Hi, my name is Dr. Stephen Williams, and today I'd like to talk about your dog's health. Heartworms is probably one of the most common things we're seeing right now. We are actually treating between 300 and 400 patients a year. I know most of the veterinarians in the River Delta are seeing an increase in the numbers of heartworm disease. The problem we've had over the past 5 years is we've seen some of the preventatives not work for preventing heartworm disease, and the dogs are actually coming up positive on the pills. So about 5 to 6 years ago, I started noticing that a lot of the dogs we were treating for heartworms were not responding to a baby treatment called ivermectin. I was giving the dogs a shot and the babies weren't dying. And then people started coming in and the pills weren't working. The dogs were getting 12 pills per year, but the dogs were still coming up positive for heartworms. Well, there was a lot of research done by a doctor down in Auburn University because they were feeling like we were developing a resistance. And this resistance really is hovering around the Mississippi River Delta. It goes up about as high as St. Louis now, but it's really more in the southern states. There's a hot spot in Texas, there's a hot spot in South Carolina, but generally we've been seeing this resistance come up around the Mississippi River. And there was all kinds of theories about certain types of mosquitoes coming up from the last hurricane down in New Orleans and stuff like that, but we really actually found out that this heartworm has mutated, and the researchers did find a heartworm that was different than the regular heartworm, and it gets kind of all crazy with genetics, but they call it a homozygous worm. This worm almost looks like a genetically altered corn or soybean plant, and it literally takes 2 times the level of your regular heartworm medicine to kill this resistant worm. Well, the good news is other medicines have come out in the past 5 years that have been more effective in treating heartworms and preventing them. But I also want you to know that the game has changed on the presentation and the clinical appearance of the dog. These dogs now, instead of coughing as the #1 symptom for heartworm disease, they're literally losing weight. They are having their muscles deteriorate. So when a dog comes in and I'm feeling their backbones and you've got a lab that's supposed to weigh 80 pounds, but he's only weighing 65 and you can't put any weight on your dog, I'm automatically thinking heartworm disease. It's one of those things that for some reason the parasite is affecting the host, not only through congestive heart failure, but it's actually deteriorating the muscles, okay? So, you know, there's many types of preventions out there. The one they say is the strongest against heartworm, this resistant heartworm disease, is actually Advantage Multi. Multi has the newest generation of ivermectin. They're all in the same family, but it's called moxidectin. And if you give this Multi 3 times in a row and you literally just drip it on their back and it penetrates the dog's skin, it will literally build up in their system actually 12 times the dose, which obviously will kill the resistant heartworm. Because like I said before, it only takes 2x of HeartGuard, Interceptor, Sentinel, and the new Trifexis. So anyway, the game has changed. Unfortunately, heartworms are changing just like fleas develop resistance to insecticides. Heartworms are starting to develop resistance to the heartworm medications. I still feel that 95% of the heartworms that are out there are susceptible to the preventions you're on, but there's about 5% of the population that probably is resistant. And if your dog is in a high-risk situation, a high exposure, if they're laying outside all night next to a rice field and going to get bit numerous times by mosquitoes, I would definitely have them checked every year, obviously, and consider using the Advantage Multi as one of the strongest medicines out there.